and of course, how many people are vaccinated. One dose protects already a lot. The second dose is in the middle long term, but we'll evaluate everything. As a follow-up, concerning the vaccination, right now there are schedules of vaccinating hours that are left free because people don't show up. Shouldn't you do what they do in the United States and have a recall list to avoid that there be holes? Because this is a race, if I've understood what's been going on for the past year. The rates of appointments are pretty good, all things taken into account. We're talking in our main regions. I was looking yesterday. It's 1, 2, or 3%, and you're going to tell me that out of 20,000 appointments, if it's 1%, we're talking about 20 appointments, but it's not huge. However, we are taking into account the greater number of vaccines that we're receiving, 200,000 this week. I prefer having more schedules and that people have more availability, because we had to almost smooth out our 100,000 over a 7-day period in order to not have, jumps like that. But now that we're going to 200,000, rather than having an average of 17,000, 18,000 a day, I'm targeting 25,000, 30,000 per day. So if we have 1 or 2% of people who aren't there, I don't find it so bad. We can catch that up pretty quickly. Now, if we saw that that there was an increase in people that you're talking, well, then, of course, we could have recall lists. But within 1 or 2%, I don't think that it's a big issue for now.
Monsieur le Ministre, Dr. Arruda, vous aviez ouvert la porte il y a un petit peu plus de...
You opened the door a little over a week ago, Mr. Dubé, to the vaccination passport. And I had asked you a question at the press conference. Where are you at now with that thought process? And is that something that is with the principle that was enunciated by Dr. Arruda? Well, listen, who are you asking the question to? Well, both of us. Well, the last time you asked, and I think that I answered. But yes, but there's been 2 weeks between the two. Where are we at? Is that something that is being studied? Well, I can answer if you wish, but I had been very clear that I believe that in a context where our government wants to be more and more numerical, something that was given on a piece of paper to have a vaccination proof that we used to have on a piece of paper before, and now being able to have it on a phone, I don't think that there was anything extraordinary about that. So anyway, I talked about it and I asked that we do everything possible so that when it is possible to do it, it's done. But I think it's part of to have that information, to be able to make it like that. My question is what we understand by that. If it's for traveling, because there are some countries that require vaccination, yellow fever or things like that, it's also a way of having, vaccination, digitized. I think it's in that perspective. If it's in a perspective of giving access, differential access to people in a place or another, I don't think that the government wants to go there. There are perhaps companies that will decide that they will require vaccination to be able to have access to their premises, but I don't think that its intention as such, because we believe, thankfully, taking into account the history, Quebec, most people will be vaccinated. So we'll end up in a situation where circulation will decrease and it won't be necessary to control access to public places through a vaccination passport, I believe. As a follow-up, Mr. Legault, a year after the pandemic, what is the impact that you believe that this will leave on the public, on people's morale? You saw over the week an important protest of people who want to have more opening for sports and all that. A lot of people saying that it has an impact. So what will that leave, do you believe, on the moral aspect? Well, we have to make a difference between, let's say, the following month and after. I believe that, of course, as long as there are restrictions, people will continue being sick and tired of them. So after a year, it's harder than in the first weeks. Now, afterward, of course, there will be impacts on mental health of certain people. And already Lionel Carman is working very hard so that we have all of the available resources to help those people out. But generally speaking, I believe that Quebecers have realized how important it is to have dinner with friends on Friday evening, to see and visit your family, to be close physically, to hug people. I think that we realize that human beings are social people, and I think that we are going to appreciate these meetings even more with our friends and our loved ones in the next few years. Concerning AstraZeneca, on the one hand, we're told that it's perhaps not adapted for people who are at a high risk of getting ill, but on the other hand, you're saying that you want to use it for people at home and those who are vulnerable. Which vulnerable people would be vaccinated with that vaccine, and are we comparing it, for example, people with a handicap? There's the example in the newspaper this morning, young people with cystic fibrosis. Could you give us more information about this? Maybe I'll let Dr. Arruda answer that, because those are really recommendations from public health. Something that has to be understood is that the AstraZeneca vaccine, it's important to say, it's very good vaccine. It is comparable to the others as far as preventing deaths and hospitalizations. Even the recent studies that took place in the field showed efficacy that is sometimes in situations even superior to the other ones. So it has the advantage of being able to be easily transportable. So clients who couldn't have been vaccinated quickly enough with other vaccines right now are going to be able to have access to that vaccine. And taking into account the fact that it is, as far as the other groups are concerned that you were talking about, people who are very often who are less than 60, etc., we have asked our immunization committee in Quebec to review, to be able to look at the target groups and adjust them. The following groups. But soon we're going to have so many vaccines that we'll be able to use the right vaccine for the right clientele at the right moment. And even if there is a sequence of 6 to 10 at the end, we feel that at some point it's going to be done, all together. So it's difficult for me to tell you right now that, to tell you who is going to receive what vaccine. But we're always going to use a vaccine. So our deployment plan is shorter and shorter, taking into account that being added. It'll allow us to protect people whom we couldn't have. How many people complained that we couldn't, that some people couldn't go to a vaccination center? Now we're going to go and see them at home and vaccinate them at home and protect them at home. You've said many times, Mr. Arruda, that the measure of the curfew was good because it had showed itself to be efficient. Now in orange zones, it's not as early, but there doesn't seem to be any will to remove the curfew in the short or long term. Are you thinking of keeping it over the summer? You are projecting me in time. With COVID-19, when we talk about over a week period, we're at risk of not being able to say. So this summer is really far away still. I hope that in the summer we're not going to have a curfew, at least not in the same way. So I believe that the curfew is useful. It's still useful now, but all of that will be evaluated, particularly in function of how many people will have been vaccinated and the epidemiology. If in Quebec people, rather than, if people, instead of going all over the place, they keep respecting the guidelines and the hospitalizations don't start increasing, I think that we'll be able to adjust in function of things as well, of the, sun hours, because when we change the time, it has an impact. So I think that the curfew is not going to be there forever. I'd like to go back to your example, Mr. Legault, on having dinner with friends on Friday evening. Just to be clear, because the United States, what they're saying is that once people are completely vaccinated, they'll be able to get together without masks and all that. Mr. Arruda, the question of Véronique Price your answer wasn't very clear. When might we think in Quebec of being able to have friends over at home on Friday evening without a mask? What are the criteria? What I'm saying is that it could even be before people have received their 2 doses, because in the United States, if there are non-vaccinated people with a group of people who are vaccinated, they allow those people to be together. I can't give you a date. What I want to say is that we're very conscious of the effect of breaking the isolation in people that people are going through. As soon as our epidemiology is sufficiently controlled and that we have enough people vaccinated with certain guidelines that might not be, no mask and go and hug everybody and your grandmother, we'll probably be able to allow two families to get together as exists in other countries. But it's still too early for me to be able to answer you. And, of course, the CDC solution that was brought is being studied, but there could be another one as well. As a follow-up, Mr. Dubé, on vaccination, you've already used the analogy of a car. We talked about it earlier on. We see that in the past week, the number of doses that we have is higher than the doses that are being administered. You've already promised 250,000 per day. So what do we need? What is the problem that makes it that right now we can't go further than what we said? Well, first, we can. The 250 that you're referring to is 250 per week. I would love for us to be able to do 250,000 per day, but 250,000 per week is what we did with influenza. But I think that there are three elements that are important to remember. When we say that we received doses, in 1 week, very often we take it for granted that we get it on the Monday, but sometimes we get it on the Wednesday or Friday. So in 1 week, and I think that yesterday's example is perfect for that. If the doses that we receive today from Pfizer and AstraZeneca, I couldn't distribute them yesterday. But today, if you look in our inventory, I have 200,000 extra doses that I couldn't distribute yesterday. So we're always, playing catch up. That means that last week I got doses that arrived on the Wednesday, and I had 100,000 doses to put in front of us that we succeeded 15 to 20,000 per day, which is about the average over 7 days. What we didn't want is to have a day when we had to close our screening centers. Now that we have 200,000 and 300,000 doses delivered per week, we'll be able to, go up. And regardless whether we get them on the Tuesday or Thursday, we have more doses that are going to be coming in absolute numbers, and we'll be able to increase to 30,000 a day. So there's a question of time, but there's also a question of regularity. It hasn't been a long time, that we've been getting them. Just last week, we only got them 100,000 a week. So the real test is to go up to 30,000 and 50,000. The real test is when we get doses that come in regularly. And that is why this morning, as soon as we can increase the number of appointments, we do it because, now we had some more and we could get through them more quickly. Continuing on vaccination, we know that we're going to get more. There's more vaccines that are authorized also by Health Canada. If we remove the priority people and we concentrate on those 65 and over after that, so the general public, people 40 who are 50, when might they expect to start getting vaccinated? And as Mr. Arruda was saying, how will this great block of people, will it be spread out? Are we going to go by jobs, like teachers and police officers, or is it going to go along with age groups? Well, that is a question that I had from the Premier this morning. When are we going to... No, it's Perot. No, it's not Perot. But I'll tell you what I answered him this morning. I still have a lot of uncertainties. For example, in the past week of March, and I don't want to... In the last week of March, we're going to get 440,000 doses just that week. Well, if it delays things by 2 or 3 days, then I'll have to tell you that I have vaccines that are going to be in transit. I don't want to go too much in detail, but I'll have vaccinations that will be in transit that have to go up to Gaspésie region or the Greater North. So what I said to the Premier is I would like that by mid-May, we'll have all of our 65 and over done. And if we can have that, at least for the first dose, I'd like that. And I have to say that, give us the opportunity of getting regularity so that we can organize things. But when we do start getting regular doses of 400,000 doses per week, it'll be a lot easier. And we haven't had that yet. Mr. Legault, I'd like to hear you on Montreal because, of course, yesterday there's a lot of regions that went from red zones to orange zones. We're very happy about that. But Montreal, could we have a timeline, a hope, something At what time will we be able to reevaluate the situation? When might they expect to have, certain lightening of the guidelines in Montreal? Well, we said we would reevaluate every 2 weeks. So technically, next Tuesday, we'll have a reevaluation and new recommendations. But I follow public health. And I'd like to public health notice that next week, we're going to be changing the time. So at 8 p.m., it'll be as dark or as light as 9 in the future. So I was saying that to public health so that they think about that. And seeing one's friends. And of course, as I was saying earlier on, once we'll have vaccinated all those 65 and over, and they don't want to give dates, these two too much. But let's say within a month, let's say, or a bit longer than a month, it's going to change things a lot. And we hope that we'll be able to announce good news in Montreal. Maybe just to say quickly, since this morning, we've been giving you the information on the percentage of variance. So especially for the Montreal region, it's very important. 50% of variants are in the Greater Montreal area. First statistic. Second, for the past 2 weeks, so last week and this week, we went in Quebec from 14% of positivity rate of variants to 18%. That's almost half of what it is in Ontario. That means that Montreal, in particular, and we have to congratulate Madame Drouin's team, they have succeeded, Dr. Drouin's team, they have succeeded in controlling the variant up until now. Because if we stay in those percentages, we're not yet, in the exponential. That's what we have to follow quite a bit. That's why I look forward to getting the results of the spring break. And I think that the Premier will be able to make important and significant decisions next week if we can control the increase of variants like Montreal has succeeded in doing, I would say, relatively very well up until now. We've heard a lot in the past few days, Mr. Legault talk about the pandemic and go over the past year. Mr. Arruda, I'd like to hear you now. How do you evaluate the quality of the response of public health, the direction of public health to this pandemic in the past year, and how do you evaluate the management that you've made of this crisis? Well, just like in any situation, I would say that if we had known certain things before, we would have done them differently, but we always have to look at the context. I believe that we followed the expertise adequately. We followed science. In hindsight, some people are telling us, well, such and such article happened in such and such a date. Why did it take 6 weeks before? Well, when we make decisions that will affect the public at large, we have to have solid evidence. We were precursors in things, for example, vaccination with, protecting more people, like increasing the delay between the 2 doses. So without being perfect, because I cannot consider that we could ever be perfect, but I think that we always try to do the best for the Quebec public. Sometimes people, reproach me with the mask, but I think that having people start wearing masks, it's not something that we can do from one day to the next. We had to learn about distancing and hand hygiene. That when face coverings arrived, anti-mask movements started. When we face the public, it's not just one person, just one patient, it's entire category. We have to take people's behavior into account. So I think that we haven't done worse than elsewhere. And as far as vaccination, however, I am proud of the National Institute with the recommendations that they've given us. I think that having vaccinated many more people right now makes it that the outbreaks in CHSLDs right now in the second wave, I think that we are all very marked by what happened in CHSLDs in the first wave. Nobody can remain insensitive to that, to the suffering, to the mourning. And we're going to continue, even after the pandemic, to take care of those most vulnerable who had impacts in terms of mental health. I'll end here because the question period is ending soon. Yes, and we have many questions left, so very quickly, Mr. Bergeron. Mr. Legault, you said lately in a statement that public health proposed sometimes to you things that were not feasible. What has public health proposed to you that was not feasible? Inaudible comment in the room. I had an idea in mind when I thought about that, but it had to do with the schools, I think. Oh, yeah, it was to say half-size classes. Half-size classes, that means that we would have needed twice as many teachers. And I questioned the Minister for Education, and he said that it was impossible to have 2 times as many teachers, but it would have been ideal to have half-size classes. So it's that kind of thing that we talked about together to be able to see whether it was feasible or not. I think that's normal. Okay, we're really running out of time. Short question, please. Mr. Legault, we've been hearing on the radio for a few days an ad paid by the government of Quebec on the pleasure of moving at 100 years. Don't you think that it's a weird message with all the young people where it's like, you know, it's beautiful to do sports and take advantage of it, whereas there's so many young people in Quebec that can't do sports? Well, I think that we can move. We can move outside. We can walk. We can run. We can, you know, ski. The arenas are open. There are activities that we can do outside. We are reopening extracurricular activities inside. But yes, in fact, you know, it is important to move, yes. But while respecting the guidelines, I think that it is possible to move. Mr. Dubé, on vaccination, if the staff is there, if the doses are there, could we go, you know, could we consider to really, you know, have vaccination open 24 hours a day and really go for it? All options are being considered. And do recall there are pharmacists starting to work with us next week, and that already, I believe, that the minimum that pharmacists are going to do once we get the vaccine is another 100,000 per week. I think that they can do a lot more because they've done even more than that during the influenza. But once again, we are limited by the number of vaccines that we have, but we could increase. Yes, we could increase by a lot. We have all the resources to do so. And we're still limited by time. I'm sure that you heard that on PEI they said that they would be ready to share their vaccines. Is the discussion being done between provinces that are not as affected, you know, those less affected, saying, you know, we could give you some more and then come back in the summer. You can give, you know, them back in the summer. I think that we haven't talked about that. We need our vaccines right now, but if there's anybody who wants to offer them to us, and that is why we said yes to AstraZeneca so quickly as well. No provinces have offered you any vaccines? No, not yet. Mr. Arruda, to hear you about the vaccination of children. There's the studies that have been made by Pfizer right now for teenagers 12 to 17, another study being done as well for a similar age group, but right now we're not thinking about that. So you're not thinking of vaccinating them? Is that what you're saying? Well, we'll vaccinate them if recommended, but right now it's not being recommended. And taking into account that the priority is to prevent constipations, it would be later in the sequence at any rate. Last question in French. Mr. Dubé, you quickly selected a use for AstraZeneca for home vaccination. Do you already have the data that would allow you to say what the Johnson & Johnson vaccine is going to be used for? Not yet. We're going to wait to get the comments of public health. The British government proceeded or is proceeding to vaccination 24/7. Is that being considered? Do we have enough human resources and vaccines to do that? We're going to have all the necessary resources. We already have an extra 600 people who are recorded on Je Contribue. It can be evaluators or vaccinators. We're not going to have a lack of staff. What we need is vaccination. So the 24/7, it could be taken into account because the great vaccination centers, the mass vaccination centers, they can do it. That completes for questions in French. Now English questions. I've been told that we can go over time a little bit. You've been pretty disciplined, so.
On the AstraZeneca vaccine, I'd like to hear your reasoning. The recommendation is 65 years and older should not be receiving that vaccine. You've decided to not respect that recommendation. Why?
No, au contraire.
In fact, the vaccine is homologated for 65 and more. That's the Committee of Immunization of Canada who decided to don't recommend it because they find that they had not enough data, but we have actually data from other other countries too, even UK, and others are using it after 65. And based on new data, and I think probably the Canadian immunizations will change their mind soon. New data, they protect against hospitalization and I would say and death for the elderly, even if they are more than 65 years old.
Can I continue?
La question commence.
Ouais, il n'y a pas de problème.
Okay.
Moi, j'ai juste répondu à la question du
bon.
Premier ministre.
On me confirme qu'on peut poursuivre jusqu'à E5. Ça vient de votre
OK.
cabinet, M. Legault. Alors, en sous-question rapidement.
Okay, yes. I'm also wondering about keeping race-based data and social economic data on people receiving the COVID-19 vaccine. For instance, how will you know if low-income racial minorities are being vaccinated if you do not collect that data?
We know, I would say ecologically, that where are the spots where there is those low economic without having it person per person. But I would say we will do the maximum to vaccinate everybody who wants to get vaccinated and use different strategies to go to be in contact with those populations.
Avantage de faire affaire avec les pharmaciens.
Of course, I think that it's a good thing to do business with pharmacists. Oh, in English, please.
Advantage of using pharmacists because they know their local clientele. And that's one of the reasons we accelerate the vaccination with the pharmacists because they know their area.
Rapidement, Matt Grill, CTV.
Afternoon. Just a quick question regarding the second dose of the vaccine. How long do you think before senior homes receive, all senior homes and all its residents receive a second dose of the vaccine?
It's actually, it's going to be 16 weeks after the first dose.
Do we have a timeline as to when that would happen?
The timeline exactly?
Well, what would be the latest date?
I would think as we just finished, it's about, I would say, around 13 weeks from now, from what I can see macroscopically. I must make some verification because we, I think, finished them 3 weeks ago. So we will have to add, I would say, 13 weeks.
Philotier, de Gazette.
Premier, what good day? What is the point, the magic point where we will be able to say the worst is behind us? Is it people over 65 vaccinated, number of cases? What is the magic moment where we will be able to say the worst is behind us?
But there are many factors, including the recommendations of Dr. Arruda. But personally, I follow the number of people of 65 years old and more, the ones that have been vaccinated. I think that it will be a complete new ball game when all of them will be vaccinated because, again, I repeat, 95% of the deaths are coming from this group.
Second question.
And Dr. Arruda, just a quick update on the variants. You were talking about sharks in the water. Is the situation any better in Montreal?
The situation is, I would say, uncontrolled in Montreal. It went a little bit up, I can't say, but it's under control because we see that even if they get more variants, there is no cases going up. But it needs a very tough work of public health people and ask people if they get sick to get screened. And also, they will probably, if there is cases in school, there's going to be a more aggressive intervention by public health.
Très rapidement, Katsune.
Mr. Arruda, for people 70 and older, I understand that even though they received a dose of Pfizer vaccine, they cannot see their loved ones. They cannot see their families if they have received the dose and they are 70 and older.
For the moment, no. As I'm telling you, we're going to look at the new epidemiology, what is going to happen, and see in which conditions perhaps they can meet their loved ones.
You give a lot of hope to Quebecers today, Premier Legault, for 65 and older being vaccinated, that gatherings, indoor gatherings will be able to come back. But why have you not waited specific guidelines like what the CDC has done in the U.S. to announce this to Quebecers?
But I think it's important that people see the light at the end of the tunnel. We know that we have some weeks that will be difficult in front of us. I'm asking people to continue to follow measures. I've seen people in the street about sport last weekend. So what I'm telling them is please wait for the next few weeks until all the people of 65 years old can be vaccinated, and then we can hope to have good recommendations and that we can ease the measure.
Il met fin au point de presse. Merci pour vos bons mots. Merci pour votre...
Thank you for being here, and thank you. And of course, Marco always has a tighter grasp on how the press conference goes. Thanks you very much.